A health destination, here is what has become of the Cameroon's septennial of high achievement. This year, during which the infrastructure, Wallet pays 2,387 hospital training, with 7 general hospitals, 8 centers and 14 regionals. A boom which puts an accent on the technical platform, such that in Cameroon today, there is 5,650 inhabitants for a health center.
We have put in place great hospitals, such as the Gynecology, Obstetric and Pediatric Hospital of Douala, the Saint-Melima Reference Hospital, the Caser, the Center of Human Reproduction, and equally the Yaoundé Emergency Center. All of these have permitted to save numerous lives and also to reinforce our capacities in reacting to emergencies, most especially the public road accidents. The Caser today is a reference in the sub-region and even in the world, wherein women come from other countries to solve their fertility problem. Moreover, the president does not want Cameroonians to leave their regions in order to have quality treatment. That is why we have a country with the greatest number of quality hospital construction sites.
With a democratized infrastructure, the disease had no choice other than retreating or being eradicated. In Cameroon, one does not die of neonatal tetanus, talk less of Guinea worm. The country has a mastery of cholera despite his neighbors.
The situation at the level of Cameroon is under control. I say under control because we observe the situation in 2 regions, but now we can limit it just to a region. But that doesn't mean that the other regions are not watchful.
The management of the disease is illustrated to the advantage as regard pandemic. More than 260,000 people are on treatment concerning the 8 virus. 75,000 percentage of Cameroonians know their status. It should be noted that antiretroviral are free, resulting in a drop from 4.3% in 2011 to 3.4% in 2018. As well as the fight against 8 virus is winning grounds, so do the fight against malaria, which made 3 million patients and death per 1,000. The rate of mortal death has left from 38% to 25%, thanks to the support of the free tests with anti-malaria drugs. Mass campaign conducted convened 21 million mosquito net impregnated of insecticide with long-acting, which pregnant women receive freely with a treatment against malaria.
When you have malaria, there is no need for you to reach the hospital anymore. No matter where you are found, there is always a health agent. And this is no more a time where we are talking of controlling malaria, but eliminating totally this disease. The elimination needs a strategy. The first strategy is that all Cameroonians need to gain access to diagnosis and to treatment. All Cameroonians need to gain access to good malaria drugs.
Tous les Camerounais doivent avoir accès aux bons médicaments du paludisme.
The fight against the disease also shows that since 2014, no case of white polio virus has been detected, making Cameroon a country through which poliovirus is no more exported with the indispensable contest of our faithful partners.
In the year 2013 and 2015, this disease cost almost 43 billion 290 million francs, and in that money, the state used just 3%. 70% of this money was given by UNICEF and 33% by the WHO, the World Health Organization.
3% par l'OMS.
Partners who have shown in other domains of the public health to Cameroonians, such as the Nagra Eye Co-Eye, in 2016 was already maintaining the look place by orbit of the United States in favor of Cameroonian eyes. The Children Action Franco-Belge, or the Mercy Ship, from the name of this magic boat.
Il y a des textes qui ont été signés l'année passée. les textes relatifs.
There are some texts which were signed last year, texts related to the granting of bonuses for the staff relevant to the code of work. The category, that is, most of the staffs were categorized because we realized that some staffs who were supposed to be on the 9th category were instead pulled down to the 8th category. So the administration was asked to pull them up back to the 9th category and also to take care of them and their nuclear family.
Puis en 9e catégorie. Et la cerise sur le gâteau, c'est la prise en charge du personnel malade et leur famille nucléaire.
Health coverage is still on with free vaccine against meningitis, pneumonia, and antigen against BCG. Children from 6 to 59 months consent to the first chief are seen benefiting vitamin A, and its support is being given to those suffering from malnutrition, which is sometimes a fatal land for green bowel and other bilharzia.
Il était très fréquent de rencontrer beaucoup d'enfants qui avaient du sang dans les urines.
It was frequent to meet children who had blood in their urines and others equally urinating blood. And this presence of blood in urine was considered as a normal phenomenon in some localities in Cameroon, where children, mostly boys who were from the age of 10 to 12 years, had blood in their urine. And this was considered as a sign of puberty. These boys were somehow compared to girls who at that particular age had their menstrual period. So, to an extent, when you do not have this, either as anemic or not very normal, the phenomenon is becoming very scarce. There are many localities where we no more find signs of premature cases, and this is thanks to the direct effect of the actions carried out by the Ministry of Public Health. So we can probably say there is a regression and disappearance related to the serious morbidity of this illness. In 2006, the number of children disinfected were close to 170,000, and in 2017 we went up to 9 million of children disinfected by intestinal worm. As what concerns pyrosis, in 2006, we had close to 30,000 children disinfected, and nowadays we have close to 3 million children disinfected in these areas where the illness is found.
Et de nos jours, il y a près de 3 millions d'enfants déparasités dans les zones endémiques pour cette maladie.
Healthcare from its base has quality epithet. Since 2012, hepatitis patients have their own specialized doctors, among specialty in which Cameroon has set regarding the sanitary formation. Less will not be said for tropical diseases neglected, such as filariasis and many others.
Des prévalences de près de 90-100% les années antérieures.
The prevalence from the past years can be rated from 90 to 100%, but nowadays the rate of prevalence is assumed to be at 5 to 10%. These statistics shows that there is a remarkable progress in the fight against onchocerciasis. The other virus on the Ministry of Public Health, together with its partners, are working on, and it is in this domain that we mostly have a remarkable significant advancement, and close to 80% of these districts are safe from the filariasis of fatigue. And according to some recent studies, the filariasis of fatigue has been completely eliminated in most of these health districts.
Les dernières évaluations qui ont été faites, la filariose lymphatique a été éliminée dans la plupart de ces districts de santé.
It is left to Cameroon to access the final stage of the universal health coverage. The President of the Republic prescribed it. Until date, foundations have been set for women to stop dying while giving birth. Various actions have been taken, on which the availability of optical kits, health check, which help the pregnant women by paying 10% of the normal price. Since 2015, more than 75% of pregnant women have benefited from it.
Nous avons déjà une carte sanitaire qui montre que rien que le secteur public avoisine les 3000 formations sanitaires.
Studies that have been carried out clearly shows that the public sector has close to 3,000 health facilities, and if added to that of the private sector, it can be counted up to 5,000 health facilities. This was at the beginning. The other important part is the human resource. A country without a good human resource cannot afford a global health coverage. Every year, we train doctors in both public and private health facilities. We have close to 4,500 personnel who graduate every year from those schools. So we can proudly say we have a qualified personnel waiting. What is now left is to know the device, that is, how to get finance to support Cameroonians. So we've decided to start with the basic and most demanding treatments. These treatments that constitute the foundation of the sanitary pyramid. That is, health center, medical center, and health district. This decision resulted to over 300 interventions and sub-interventions. After evaluation, we now know how much this could cost, and since Cameroonians are not of equal status, the President of the Republic has decided that those who gain more will pay more, those who don't work will pay nothing, and those who gain less will pay less.
Le bilan sanitaire du président Paul Biya.
The balance sheet of the President of the Republic from 2011 to 2018 is praiseworthy, and he has acted a lot as far as the health of Cameroonians is concerned.
Sur la prise en charge de nos problèmes dans le secteur de la santé.
A noble challenge which was taken by the Cameroon Public Health, which lies on a three-step: the diagnosis, the treatment, and being watchful. That is it for the public renewal.